A very good evening to one and all. This is Batul, the moderator for today's session from ITCP, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is here with us today. With great pleasure and honor, I would like to introduce our very renowned stalwart and very renowned pediatrics, Dr. Alok Gupta, sir. Sir is MBBS, MD, FIAP, Chief Pediatrician, Counselor and Environmentalist at Indian Academy of Pediatrics, Jaipur. With Sir's wonderful insights, we are going to talk about the topic for today, which is noise pollution effects on health. So now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you. Please proceed.
Thank you, ma'am. Good evening, ladies and gentlemen, dear colleagues. It is a pleasure to be before you, and for the next 30 minutes or so, I'll be talking about noise pollution and its effect on health. Hearing is the sense with which we perceive the sound around us. Through hearing, we engage with our environment, communicate with others, express our thoughts appropriately, and gain education. Globally, 1.5 billion people, that is 5% of 8 billion, experience some decline in their hearing capacity during their life course, of whom at least 466 million will require care. Loss of hearing, if not identified and addressed early, can have a far reaching consequences, adversely affecting language, speech, cognitive development, listening, communication, education, psychosocial health, earning, employment, mental health, relationship, identity issues, stigma, and quality of life as a whole. Some key facts are that 466 million people globally have disabling hearing loss, needing rehabilitation. Projected is 700 million in, sorry, this is, I did some, yes, sorry for the interruption. Projected hearing loss is 700 million in 2050. That is one tenth of the people, one tenth of us will be having some sort of hearing loss. 40 million of these are children, and 60% of the hearing loss in childhood is preventable. That is very important. 1.1 billion young people aged between 12 and 35 years are at risk of hearing loss due to exposure to noise in the recreational setting, a fact which is not known to them. Over 2.5 billion, one in every four-person, will have some hearing loss by 2050. Unaddressed hearing loss poses annual global cost of 80 lakh crore rupees, that is 1 trillion US dollars. Interventions to prevent, identify, and address hearing loss are cost effective and can benefit individuals immensely too. People with hearing loss benefit from early identification and management. Many causes of hearing loss can be prevented, which are common ear diseases, ear infections, vaccine preventable illnesses like mumps and rubella, exposure to noise, tobacco smoke, chemicals, which endanger the hearing of many people at different ages. National Health and Nutrition Examination Survey, USA 2006 data shows that hearing loss in teenagers increased from 3.5% to 5.3%, and it is about 6% at present. Personal audio devices music use increased by 75% by 2005, and it is nearly 100% now. 50% of the 12 to 35 year have risky behavior of using them for 16 to 18 hours every day at high volume. Excessive sound at workplace caused noise-induced hearing loss in 16% adults. Noise affects many systems of the body, but these two are totally preventable. Mitigating such risks through public health action is essential to addressing hearing loss. 15% of us have mild hearing loss, which is complete to in nearly 0.2% of us. Don't make noise. This is a phrase which we have been hearing since we entered our school. Loud sound in classroom or in library meant a disturbance or an irritant to students and teachers who were studying. Well, this still holds true. What is sound and when does it become a noise? Sound is basically vibrations of particles in the medium, and they are transmitted by vibrations when the particles move in their own place, but they are not dispersed. The sound becomes noise when the sound becomes irritable to us. We'll go take this little further away. And the assessment of sound is by volume, which is measured as decibels, pitch and frequency, which are measured as hertz. Now, this is the organ of hearing. This is the outer ear, the ear canal, the tympanic membranes that compose the outer ear. Then is the middle ear, where the eustachian tubes open at the back of our nose, which has to be patent. And this air-filled chamber contains the three of the smallest bones in our body: the malleus, the incus, and the stapes, which are fixed to the oval window. There's another round window which also helps in hearing. This conducts the hearing sound, converts into action potential, which are perceived by the hearing organ, that is the cochlea, and then it is transmitted to the brain and the auditory system. Sound is produced in varying frequency ranging from 0 hertz and above. We human beings with normal hearing can hear frequencies which range from 20 hertz to 20,000 hertz. This is the audible frequency. Below that is the infrasonic, and above that is ultrasonic. These are the some sound levels in same duration. In outer space, there is vacuum and there is no sound at all, though no sound is transmitted. In the sleeping area in the bedroom and in the night, it is 20 to 30 decibels, which is a safe period is 16 hours. We are talking at present in a busy office where the sound levels of 80 decibels must be present. It is safe only for 8 hours. In the nightclub, it rises to 110 decibels and not more than 1 hour is safe. Airplanes and aircrafts, we cannot be there without protecting our ears. Sound is referred to as noise subjectively. Any undesirable sound can be called as noise, and technically, sounds which are not pure or rhythmic are known as noise. So, a sound becomes, when it disrupts one's quality of life, maybe temporary or permanent, it becomes a noise. And when this noise becomes, it affects a group of human beings or most of the human beings, it has become noise pollution. Now we have enough evidence that loud noise and its associated vibrations cause damage to monuments, architecture, building, and other similar non-living things. Even plants are disturbed by noise, and this fact is disturbing. So at birth, we have got fixed number of cochlear sensory cells, that is the inner and the outer hair cells. In humans and other mammalian species, these sensory cells do not regenerate once they have been damaged. Hearing loss occurs when a person cannot perceive the sound within the audible range clearly. This can occur naturally with aging, which is presbyacusis, or due to some event, which is stroke or injury, disrupting the hearing apparatus in the outer ear, middle, or the inner ear, auditory nerve, or specific areas in the brain. It may be minor when hearing of only some frequencies are lost, or major when spread across wide range of frequencies. Tinnitus hallucination can occur due to complex mechanism affecting the hearing system. A person who is not able to hear as good as someone with a normal hearing is said to have hearing loss. Hard of hearing people are those with hearing loss is ranging from mild to severe. Deaf people mostly have profound hearing loss, which implies very little or no hearing. They often use sign language for communication. Then the types of hearing loss is conductive when outer and middle ears are involved. Sensory neural when the inner ear, auditory nerve or brain involvement is there. And it may be mixed when both of them are affected. The degree of hearing loss may be slight with a loss of about 20 decibels, or it may be profound with the loss is more than 90 decibels. This is hearing loss with more details. We can do away with it. And causes of hearing loss common are the hereditary, congenital, and the aging or the presbyacusis. The acquired, it is the noise-induced ototoxic drugs and chemicals, infections in the pregnant mother and the child. Others are low birth weight, neonatal jaundice, birth asphyxia, trauma, stroke, etc. Today we'll be limiting ourselves to noise-induced hearing loss. Babies developing organs and immune systems, smaller organs and bodies, make them especially vulnerable to environmental exposures, including noise exposure. Harmful exposures start in mother's womb and even increase the risk of premature birth. Infants and preschoolers exposed to environmental hazards has increased risk of diseases in childhood and lifelong increased risk of chronic diseases. The cochlear damage by loud sounds occur by two mechanisms. One is mechanical, where rigidity and effective functioning of sensory hair cells are lost by regular exposure to loud sounds gradually over a period till they are permanently destroyed and become non functional. Second is by cellular level intense metabolic activity, where intense exposure to loud sound require high energy levels to protect themselves. High oxygen consumption leads to increased level of free radical generation in the cochlea. Antioxidant defense system in the ear fails to neutralize the free radicals generated and permanent cell death occur. These are the normal sensory cells. These are the damaged sensory cells which cannot be regenerated. And if they are not regenerated, the number of sensory cells is directly proportional to the degree of hearing loss. Somewhere in between, there's a temporary hearing loss where not so permanent damage occurs. This is the way the sound wave travels from the outside to the ear, to the auditory nerve, and to the brain. Places of noise pollution, we know it's residential, educational institutes, office, commercial areas, industrial areas, social, religious, public places, entertainment areas, transportation of land, water, and air hubs, modes of travel. Others are war zones, combat zones, playgrounds, call centers. Sources we all know in the household, it is toys, playstations, homes. In the office, there's office appliances, hammers, grinders. Entertainment, it is the radio, TV, music system, band, loudspeaker, movie theaters, etc. Personal audio devices like earphones, headphones, Bluetooth appliances. Communication devices like cell phone, Bluetooth, earbuds. Transport vehicles of every type, buses, trains, airplanes, goods train, mechanical equipment like large machines, land movers, drills, machines, vehicle use, construction and maintenance appliances, big appliances, drills, JCBs, etc. Apartments, office blocks, schools, colleges, factories, where mechanical equipment are used. Deforestation or urbanization is an indirect contributor to noise. Deforestation leads to increase in construction of houses, commercial areas, industries, road traffic, etc., which ultimately leads to more noise in the previously quiet area. Step. Now, noise-induced hearing loss may be temporary or permanent. It is permanent when irreversible hearing loss occurs due to constant exposure of sound frequencies of more than 80 decibels or a single sudden exposure of 120 decibel or above. Hearing loss occurs over small or wide range of frequencies, which is difficult to predetermine. Less than that, this exposure will lead to temporary noise induced hearing loss. US Environment Protection Agency has put 80 decibels, label 70 decibels of sound as safe upper cutoff range. Sound levels above this level have decreasing safe duration. Sounds at or above 85 decibels have a safe limit of 8 hours per 24 hours, while sound of 100 decibels has a safe limit of only 15 minutes. Correspondingly, a brief sound about 120 decibels will be permanently damaging to human hearing organs. So these are the things. What happens is we have got get tinnitus, we have got noise-induced hearing loss, and on predisposing factor like ototoxic drug presbyacousis is add-ons to the noise-induced hearing loss. We have got a reduced communication problem, social isolation, cognitive overload. We get more and more information from the eyes and other of our senses, but we can't really communicate with the other people. Impaired performance and road and safety in the public places is compromised. This hearing loss, noise induced, can occur even intrauterine when the noise of more than 80 decibels at more than 8 hours at a stretch. It will lead to high frequency hearing loss to both mother and the fetus, prematurity, low birth weight, and birth defects. The newborn, more than 45 decibels exposure can damage cilia of the cochlea, leading to hearing loss, increased blood pressure, heart rate, respiratory rate, and decreased oxygen saturation, increased need in oxygen and energy consumption. It leads to changed behavior and physiological responses of the infant, and it enhances the pain perception. In a child, more than 70 decibels for prolonged period or sudden exposure of more than 100 decibels lead to learning disabilities, attention disabilities, rupture of eardrums. These are other auditory and the non-auditory problems which are associated with noise pollutions. We are come to quickly go through them. Tinnitus is hissing, buzzing, ringing, whistling, grinding, similar abnormal sounds often heard by many of us in one or both ears. They seem to arise close by in the surrounding areas like the sounds of crickets, jingur जिसे कहते हैं. When these sounds occur frequently or become continuous, they are known as tinnitus. Tinnitus can be very annoying and it increases as we age. This hidden hearing loss or HHL is very important. Hyperacusis occurs or there is a difficulty in hearing. Tinnitus occurs through undetectable on pure tone audiometry. The normal hearing is present between 250 to 8000 hertz range. Cochlear synaptopathy occurs before hair cell destruction, which then finally progresses to permanent hearing loss. Then the worst is the noise induced hearing loss. When very loud sound, which is sudden, may lead to perforation of the eardrums or acute tympanitis due to sudden strong force of the sound waves. It can occur through gradual loss of hearing due to prolonged exposure of noise in sensory neural hearing loss. This is due to irreversible damage to the hearing organ of the inner ear, the auditory nerves, and or to the nervous tissue of the brain. WHO estimates that 1.1 billion young people worldwide could be at risk of hearing loss due to unsafe listening practices. Nearly 52 of the 12 to 35-year-old in the middle and high income countries are exposed to unsafe levels of sound from personal audio devices. 40% of them are exposed to potentially damaging sound levels at clubs, discos, and bars. Noise in recreational setting is unsafe levels of sound in nightclubs, discos, pubs, bars, cinema, concerts, live sporting events, and even fitness classes where music is played loudly. Recreational devices like personal music players, video game consoles that emit sounds are commonly operated at unsafe volumes. Hearing can be damaged by regular participation in these loud activities. The threat to hearing loss due to recreational exposure we discussed to noise is real. Pets are now proven to cause of noise-induced hearing loss. Output regulation for pad varies from country to country and not followed strictly. Commonly used pads have an output range from 75 decibels to 136 decibels. Volume set by users of these devices commonly ranges from 75 decibels to 105 decibels. 50% of young children and adults, including adolescents, use pad constantly or at high volumes. When this habit of routinely using pad persists for some years, high frequency hearing 4 kilohertz start getting affected. With time, the higher and lower frequencies start getting affected, leading to permanent, irreversible sensory neural hearing loss. This noise-induced hearing loss gets worse with age as aging and other causes of hearing loss pitch in. In US study, 12.5% of the children between 6 and 19 years of age have a varying degree of permanent hearing loss due to increasing noise pollution. Ambient noise is not blocked out by low quality earbuds. Music by tiny speakers are directed right into the ear canal. Bass transmission is poor by earbuds. The user keeps increasing the volume for better sound effect. Better space buffering between the ear canal and music is provided by outside the canal headphones, but they too do not transmit bass effectively, being of poor quality. It compromises the use of pad, compromising road safety, reduced social communication, cognitive overload, and impaired performance. Air block, ear numbness, vac accumulation, otitis, tinnitus, and noise-induced hearing loss is the result. WHO advice says that it is best that you should make sure that your children avoid the use of headphones when possible. Use only headphones that provide information about the risk for hearing loss. Parents should ensure that the children do not increase the volume when they are not supervised. Some devices may be equipped by parental control that allows parents to control the loudness level of the device. Two types of headphones are available. One is the noise cancelling headphones, which use inverse waves to cancel out the incoming low frequency sounds like the hum of an engine or rumble of the traffic, but not the higher frequency sound like a sound of the conversation. And there is the noise isolating headphones, which create a seal around the ear and form a physical barrier between the ear and the outside noise. These are the safe sound levels where at 25 hours of exposure at 80 decibels is safe, but 120 decibel exposure for 9 seconds will lead to permanent hearing loss. So, how do we get through this? We should be listening at a maximum of 85 decibels for less than 8 hours a day. We can use a decibel meter in the phones provided. And there's a 60-60 rule where listening to music for less than 60 minutes at a time, less than 60% of your device maximum volume. So if the volume range is 0 to 10, we fix it at 6 or 5 or 4. Below 6 it should be, and not use it for more than 60 minutes at a time. WHO says that don't listen to headphones on the day you are supposed to go for a concert or any outdoor musical event or something where high noise is possible. Now, non-auditory health hazards are noise annoyance and noise sensitivity, sleep disturbance and insomnia, cognitive impairment, cardiovascular disorders. Noise annoyance is when we are annoyed by some noise in our vicinity. We get over it if it is minimum and we carry on with the work, but in the back of the mind we are gradually getting more and more annoyed. Noise sensitivity is when even a small noise disturbs our activity which we are carrying out, and it spoils our performance. Effect of noise during sleep is dependent on stage of sleep and occurrence of awakening. Chronic effects of nocturnal environmental noise on health are seen because HPA axis and sympathetic nervous system suppression and release of anabolic growth hormones get affected by sleep disturbance and arousal. Insomnia results, deprivation affects the immune system, appetite, and carbohydrate metabolism. Hormonal imbalance between ghrelin, insulin, and leptin occurs, leading to adiposity, increased BMI, and risk of type 2 diabetes. The cognitive impairment occurs, sleep deprivation and annoyance lead to cognitive impairment. Cardiovascular disorders happen, like increase in blood pressure, heart rate, cardiovascular events are similarly affected depending on the personality traits. Systemic inflammation is increased as reflected by increase in CRP, TNA alpha, and IL-6 levels, and are cause of increased morbidity and mortality. Recommendations of newborn hearing tests soon after birth are well in place. This detects the hearing disability in the newborn for the congenital and the hereditary causes. After this, the hearing in human beings is not tested till after some loss is suspected by the parent or a teacher for child's lack of attention, poor school performance, or delayed development. Older children and adolescents may directly or indirectly indicate hearing issues by selective use of better ear, using louder sound volumes, or inability to hear as well as other siblings or peers. Unfortunately, by this time, as it is with vision, the hearing loss becomes permanent, which can only increase with time. Effect of moderate sound are cumulative in nature, as well as other factors damaging the cochlear structure, including aging process, which adds to gradual loss of hearing. So hazard recognition is very important. Silent zones, nose or horn zones are very much in need. The residential area should not have heavy vehicles plying on those roads. Last Wednesday of April of every year is now observed International Noise Awareness Day and No Horn Day. We have got our Central Pollution Control Board, which has got definite criteria in daytime and nighttime noise, which range from 50 to 75 in the daytime, from 40 to 90 in the nighttime. Any deviation should be reported to the Pollution Control Board and the police. Now, how to reduce, promote, and coordinate these events which do not affect the sound? So we have to reduce our exposure to noise while conserving the quiet areas, promote interventions to reduce exposure to noise and improve health, coordinate approaches to control noise sources and other environmental health risks, involve and inform communities, and the recommendations shown source by source are shown in the table in the next slide. The road traffic to leisure noise is given, which is 53 to 80 decibels per week to 70 decibels per year, while night exposure should be not above 45 decibels, which is a strong evidence that the area should be quiet in the night. Tinnitus or difficulty in hearing in one or both is the presenting complaint. Onset may be sudden or gradual, increasing difficulty in hearing conversation in party, meeting, or noisy place. Thorough examination of the ear by tuning fork test and audiometry will need to confirm the hearing loss and its extent. Appropriate audiometry tests are taken as per the age and other possible factors. Acute noise-induced hearing loss can be reversed, where person should be shifted to a quiet room immediately. Antioxidants and hyperbaric oxygen can help in limiting the damage. Exposure to loud sounds in future must be avoided. Earbuds and earmuffs should be used to protect the outside noise, and this may decrease the sound of by 15 to 45 decibel from entering the ears and protect our hearing apparatus. In the chronic noise induced hearing loss, the we can further just protect the further loss to the hearing, and exposure to loud sound must be strictly avoided. Hearing aids have to be used like cochlear implants, bone conduction and middle ear implants, sign languages, speech recognition, etc. So this is how a cochlear implant is implanted with the electrode at the cochlea, with the internal receiver at the skin outside the ear, and there's an external transmitter and the receiver microphone processor. So as an individual, we should keep the volume low, and good quality pads should be used. We should avoid the high noise level areas, minimize the spend time in the noisy places, protect ear and hearing in the noisy place by using earbuds and earbuds. Keep the volumes of our sound systems low. Avoid toys which make loud noise. Avoid home industry. We should protect in the ear in the home where the loud noise is there. And we should monitor personal sound exposure, and maximum total sound exposure should be kept below 80 decibels for 40 hours per week. Check the hearing regularly by phone apps like Hear WHO app and by ENT doctors. So the unwanted and undesired sound of low or high intensity, which becomes noise, which has adverse auditory effects and directly affects other systems of the body. Noise induced hearing loss is very common but entirely preventable. It is unreversible and permanent once it occurs. Public awareness is very important. These are the sounds which need to be put where the sounds are loud. There are many associations which work for preserving of our hearing, and the parents, teachers, pediatricians, managers, manufacturers, governments can do a lot. We should make the listening safe. And the hearing loss starts intrauterine, goes on to the adult as we grow older. This is a Hear WHO app which is present on the in our this Play Store and the Apple Store, which we can download and do a test on ourselves. If professionals and we group testing needs to be done, there's a Here WHO Pro which can be downloaded and used. On in the our own phone settings, we have got certain apps. It is working all the time and taking note of whatever noise and all the sound levels we are facing. So, in the end, I would like to say that the greatest gift you can give someone is your time. Because when you dedicate your time, you are offering a part of your life that you will never get back. And I thank you for your time. Thank you so much.
Thank you so much, sir. Thank you for your overwhelming talk that you have shared on our platform and for making our viewers understand about the topic in such a better manner with all your wonderful insights and experience that you have shared with us. Thank you so much for that. Moving ahead with the question and answers round, we have received few questions from the participants. So, with all your due permission, I would like to put across those questions to you.
Sure.
So the first question is related to physiological mechanisms. So, what are the physiological mechanisms by which noise triggers stress related cardiovascular changes?
So it basically, the noise, when there's a lot of outside noise which is irritating us, our blood pressure increases, our heart rate increases, we become irritable, and that is the start of this story where the cardiovascular mechanism is affected. And if this goes on, our blood pressure, heart rate, everything will be going on increasing. If it is the irritant is present at a workplace, it will, all through the 8 to 10 hours you're working in the workplace, it will affect your heart rate, more the heart rate, and more stress on the heart it will have. And if we are this noise is affecting our sleep time, then naturally we will face insomnia, and further good quality sleep will not occur. And the oxidative mechanisms which we deoxidate or depoison ourselves will stop working efficiently, and our cardiovascular system will take the brunt of the attack.
Thank you so much, sir. Thank you for answering that question. Moving ahead with the other question, and the question is related to the risk of prenatal. So, what are the risks of prenatal noise exposure on fetal health and development?
The prenatal risks are similar in nature. When the infant in the baby intrauterine is affected by loud noises of more than 80 decibels for more than 8 hours, the similar mechanisms work for the baby also, including the mother. If the mother's blood pressure and the heart rate increases, that will affect the placenta and the baby also indirectly, as well as the hearing system of the baby will be affected inside, because the develop after 6 weeks the hearing apparatus starts developing in the baby intrauterine, and they will get affected.
Thank you so much, sir. Thank you for answering that question. Moving ahead with the other question and the last question before we conclude the session. So, the question is related to the advancements. So, how might advancements in technology and urban planning help mitigate noise pollution impact on health? Your take on this, sir.
I'm really sorry to say that noise pollution is not being tackled effectively by the urban planners. In the urban planning, in the whenever there is construction or an area is developed, the mechanical appliances and the machines used are basically not of good quality, that produce low sound which are not damaging to the ear. The signboards to keep your ear safe are not placed at proper places, so you can just put some earphone or earbuds in the ear to stop that damaging sounds. The workers are not provided with protective equipments to protect their ears. The workers who are working there in the urban development, they are not provided with hearing protection aids, and their hearing loss takes a brunt. So they are constantly at the risk of getting hair loss, and they end up with it.
Thank you so much, sir. Thank you for answering that question, and of course, all the other questions as well for our viewers and for making them understand about it. I would also like to thank all our viewers for their ardent participation that they have shown by staying tuned with us throughout the session and putting across such interesting questions to us. In spite of this, I would also like to thank our renowned stalwart, Dr. Alok Gupta, sir, who was here with us, and with his enriching experience and wonderful insights, the PPT presentation that he has shared with us on our platform to make us understand about the topic in such a better manner and in an elaborative manner. The way he tried and to minimize it and to complete the talk and within 30 minutes was really appreciable by not even, ignoring the important points. So, yeah, thank you so much, sir. Thank you for doing that for us and for the viewers. And before we conclude, sir, any last take home message from your end?
I thank IJCP for providing me this platform, and I thank the audience, and I thank you, and I would be very happy if I was able to put my message across that we definitely need to protect our ears. Nobody else will do that for us. We need to do it for ourselves. So we should protect our hearing, because hearing challenges are very difficult. And I would like to say that my 96-year-old mother is now not able to hear anything, despite using the hearing aids. And I can see the agony we have because we cannot communicate with each other. So, with this, I would like to say that please protect your ears. Don't use the hearing aids too loud, and follow the 60-60 rule, and get your hearing tested, say every 5 to 10 years, because that is what we never do. And once the hearing loss occurs, it is permanent. Mind you, it is permanent. It cannot be reversed if it is of the short, gradual type.
Thank you so much, sir. Thank you for such a valuable take home message for all our viewers. And of course, indeed, it is very important for each one of us to understand that yes, hearing loss is not a matter of joke. So we need to take this very seriously because the way our generation is progressing, definitely in earlier times, it was not that much of hearing loss that we used to hear. But right now, the way our generation is progressing in terms of technology, in terms of using the all kind of things for your ears, of course that is too harmful. So with this note we would definitely take a note of.
We see 90% of the people on the roads, outside on the streets, and even in the homes with the earbuds in their places nearly
Correct.
24
Right.
hours. That is
Absolutely.
very dangerous. That is very dangerous.
Right, so right, absolutely correct. So yes, the young generation, the middle generation, and of course the generation followed by that, we need to take care of. Rightly said by Sir, we have to take a note of this, and we have to try and improvise ourselves for better health of ours, and we have to take this step for our implementation. So with this, we would like to thank you and thank everyone, and we will be coming again with another episode, another session of ours. So stay tuned till that time. Thank you so much, sir.
Thank
Thank
you.
you.
Thank you so much.